everybody, it's Dr. Ying Qi with OC Hand Surgery. Welcome back to another episode of In Good Hands with Dr. Qi. Today, we're going to be doing part 2 of the lumps and bumps of the hand and wrist, and specifically, we'll be talking about ganglion cysts of the wrist. So, ganglion cysts are extremely common, and they're usually very common on the wrist. 80% of these cysts are on the dorsal aspect of the wrist, which means it's on top of the wrist. 20% are on the bottom or volar aspect of the wrist. These are sometimes spontaneous, so not related to anything, but many times they are related to overuse or injury. For example, my patients who, works out a lot or do a lot of lifting or repetitive motion tend to be at a higher risk of developing a ganglion cyst. And these cysts are usually round, pretty firm, not very mobile. And one key feature of wrist ganglion cysts versus all these other type of mass is that the wrist ganglion cysts tend to fluctuate in size, which means some days they're bigger, some days they're smaller. Compared to other type of mass, which if it's a solid tumor, it never really shrink in size. So if you have a mass that's bigger some days or smaller other days, it's right around the wrist, either in this area or the volar aspect, you can be pretty sure that it is a ganglion cyst. So how do you evaluate when you have a wrist ganglion cyst? So when the patient comes in to see us with a wrist ganglion cyst, usually we recommend to take an X-ray. Why is it important to take an X-ray of your wrist? Because sometimes the ganglion cyst is due to injury, and we want to make sure that you don't have other problems that due to the same injury. The reason we take an X-ray is to make sure that there is no arthritis in your wrist that could cause the ganglion cyst, and there's no ligament injury that could cause bone to shift. So it is important when you come to see a hand surgeon for the ganglion evaluation, an X-ray is taken. Next, once the X-ray is taken and everything looks good, then it's basically a physical exam. So what we do is we take a look at where the ganglion is located, whether it is compressible. Sometimes doctors will also take a flashlight and shine on the cyst, and then you can actually transilluminate it, which means it kind of make it look like it's semi-transparent. So that's a for sure way to confirm that is a cyst and not a solid tumor. We'll also evaluate your range of motion to have you to perform different type of range of motion exercise, such as putting your wrist this way, putting your wrist down that way, and also to see whether you have any pain with wrist range of motion. Because majority of the ganglion cysts are non-painful, which means they're ugly to look at, but there's really no pain when they're using it. However, sometimes when the ganglion cysts are deep, it actually will push on a specific nerve, and that will make it very painful. So depending on whether the ganglion cyst is painful or not, the treatment options is slightly different. So what are the non-surgical treatments for ganglion cysts of the wrist? Initially, when the cyst is small and does not cause you any pain or discomfort, we can simply just observe it. If the ganglion cyst has been there for less than 3 months, there's actually a pretty good chance that they may spontaneously regress or disappear. So is there something you can do to facilitate that? We can try a wrist brace. You can try activity modification, which means to stop the heavy lifting and stop the extraneous activities, and to see if the cyst spontaneously regress. Back a few years ago, doctors also try to aspirate it, which means putting a needle inside the cyst and try to draw out as much cyst fluid as possible. We stopped doing that over the recent years just because studies have shown that the recurrence rate with aspiration or with draining the cyst is almost 90%. That means almost every cyst is going to come back. And by putting a needle inside the wrist joint, it does carry a slightly risk of introducing bacteria or infection into the joint. So in my practice, I don't recommend that anymore. Either we observe it or we take it out. So what is the preferred treatment of these ganglion cysts? When it gets bigger or starting to cause pain, for example, you can't do push-ups because of pain, or it limits your range of motion, or you can't really do your daily activities normally because of either the size of the cyst or the pain associated with the cyst. The preferred treatment or recommended treatment is surgical. What we do is we make a little cut over the cyst and take out the entire cyst. It is also important to get rid of the root of the cyst. Usually what we do is we use an electric cautery to cauterize the root. Surgery to take the cyst out involves general anesthesia, so you go to sleep for it. The reason for that is because the cyst is usually very deep and the root is inside the joint. Just numbing the skin is not going to be adequate to make the patient comfortable. But the surgery is relatively short. It's about half an hour or so. And after surgery, we usually put you in a protective splint. So although your fingers are free, we don't want you to move your wrist for about 2 weeks. Once the wound heals in about 2 weeks, we'll take the stitches out, and then you can start gradual activities. So does the ganglion cyst reoccur even after surgery? Very rarely. So the recurrence rate after surgical excision of the ganglion cyst is about 5% or so. However, in my practice and with our observation that it tends to reoccur a little bit higher in younger people. Most likely it's due to that young people are doing a lot more and they tend to get back to heavy use of the hand before the wrist capsule is completely healed. So it is crucial after surgery that you get back to activity slowly, gradually. Usually my recommendation is even after the stitches comes out in 2 weeks, patients should still take it easy, avoid any heavy lifting, contact sports, or push-ups for at least 6 weeks. That way we'll decrease the recurrence rate and have a better outcome. This concludes the part 2 of lumps and bumps of the hand and wrist. Make sure to subscribe to our YouTube channel, follow us on social media, and visit us at ochandsurgery.com. See you next time.